Let's have a glance over diagnosis and treatment strategies of Paget's disease. In most cases, it is discovered accidentally while performing X-ray test or blood work for another reason. But if there is a clue for Paget's disease, more tests must be performed for confirmation. We can go for radiology examination, lab tests, and bone biopsy. Radiology examination can be performed by plain X-ray and also by bone scintigraphy. Let's see what they are. We will start with plain X-ray. X-ray image of an affected person shows denser and larger bone, mixed lytic or sclerotic lesions, abnormal trabecular architecture, deformity and bone distortion. Early stages of Paget's disease have merely overactive bone resorption. A sharp demarcated area will be apparent like a hole, or it may appear in long bone as flame-shaped resorbing front. Let's dig in about bone scintigraphy. The word scintigraphy has Latin origin. Scintilla means spark. It is often called gamma scan. It is basically imaging test for diagnosis of skeletal abnormalities by using nuclear medicine. In this test, a very minute quantity of radioactive substance is administered to a patient by injection or swallowing. These then emit gamma radiations, which are detected by external gamma detectors or cameras, which provide us a two-dimensional image or bone scan. Increased uptake of radioactive material by skeleton is shown by hot spots, which are key indicators of enhanced bone turnover excluding burnt out stage. Best thing about it is that it successfully determines activity and extent of skeletal involvement, as 15% of early lesions are invisible on plain X-ray, while scintigraphy detects majority of lesions. Lab tests can be performed which help in diagnosis. First one is blood test. Elevated level of serum alkaline phosphatase is key indicator for Paget's disease. Isolated elevations of this enzyme basically reflect high bone turnover, which means increased osteoblastic and osteoclastic activity. Secondly, increased urinary hydroxyproline in urine test also suggests about rapid bone turnover. Calcium levels are normal in Paget's disease, but levels are raised in case of fracture or demineralization, as stored content of bone exits the bony cage and comes in blood and urine. Bone biopsy is the last resort for diagnosis. Biopsy is defined as extraction and examination of living cell or tissue of body for detailed analysis. In bone biopsy, a sample of affected bone under local anesthesia via needle or small open surgery is taken and examined under a microscope. It confirms Paget's disease and rules out other possibilities. You might be thinking, is there any option of prevention? Well, by opting regular exercise and a healthy diet enriched with vitamin D and calcium can maintain skeletal health. If you look for treatment, then there is no permanent cure for Paget's disease, but there are ways to tackle symptoms and future complications. If the patient is asymptomatic, he or she does not need any treatment, but regular visits are recommended for monitoring of disease progression by performing X-rays or other diagnostic tools. Indications for treatment are pain, active disease at the base of skull or in the spine, neurological complications in the cranial and spinal nerves, progressive deformity, and signs of rare complications such as high output cardiac failure, hypercalcemia, and immobilization. Now, let's jump in to see how symptomatic patients will be treated. Treatment of symptomatic patients can be non-surgical and surgical. In non-surgical treatment strategies, first is analgesia or pain relief, which is provided by NSAIDs such as ibuprofen, naproxen, and aspirin, which treat mild pain in bones due to Paget's or arthritis in association with the disease. Second option is bisphosphonates, which inhibit activity of osteoclasts, thus limiting bone resorption and dramatically decrease bone turnover. Examples are alendronate and pamidronate. They can be administered orally or intravenously as per patient's ease. Third option is calcitonin, which is occasionally fruitful to replenish bony calcium content for helping weaken bones, overcoming hypercalcemic effects, and for severe pain. But currently they are replaced with the bisphosphonates. Side effects of calcitonin are nausea and hypocalcemia. Fourth option is use of assistive devices like cane, which are quite helpful for affected pelvis or leg. Cane lessens pain by minimizing pressure and force exertion on bone and also prevent falls and reduce risk of fractures from weakened bones. Chemotherapy and radiotherapy are used to treat Paget's sarcoma. Now, we will explore surgical treatment tools which are usually reserved and pursued to treat complications. Procedures employed are internal fixation, osteotomy, total joint replacement, and surgery for Paget's sarcoma. Now let's see what is internal fixation. Application of this procedure lies in treatment of fractures in affected bone. Here, first of all, bone fragments are repositioned to the normal state and then fixed by using wires, pins, metal plates, screws. Next, we will discuss osteotomy. In osteotomy, bone wedge near defective joint is removed to shift the weight on healthier joint. In this way, pain is relieved and alignment is handed over to joints capable to bear weight. Total joint replacement is another possible solution. In this technique, defective or arthritic joint is removed and replaced with a device termed as prosthesis, which mimics normal and healthy joint. Device can be of plastic, metallic, or ceramic material. Last but not the least tool is surgery for Paget's sarcoma. It is employed rarely, but surgical removal is necessary to prevent metastasis. It takes long time for Paget's bone to get healed than the normal ones. Long-term rehabilitation might be needed. We hope you people will be equipped enough about Paget's disease. Thank you and keep watching Sqadia.